The day after you and your baby arrive home, you can expect a visit from a community midwife. This may or may not be the midwife who cared for you during your pregnancy. The midwife will offer you a postnatal check and a newborn check for your baby. The midwife will also assess how effective feeding is, whether you are breastfeeding, bottle feeding or mixed feeding, and they will answer any questions you have and signpost you to helpful resources which offer advice on feeding your baby. The Off to the Best Start leaflet has information on breastfeeding your baby. It includes signs your baby is hungry, how to position your baby to latch onto the breast, and signs your baby is getting enough milk. The leaflet also provides help with overcoming common challenges faced by those who are breastfeeding their baby. The leaflet, Guide to Bottle Feeding, offers advice on choosing formula, information on how to sterilise equipment and make a bottle safely, and how to feed your baby in response to their feeding cues. Should you need additional feeding support outside of your routine postnatal follow-ups, your midwife or health visitor will be able to offer this and signpost you to infant feeding drop-in clinics. The midwife will also provide advice on safe sleeping for your baby. To reduce the risk of sudden infant death syndrome, also known as cot death, it is recommended that you put your baby to sleep on their back, not their tummy. The feet should be at the bottom of the cot so they can't wriggle down under blankets. There should be nothing loose in the cot with baby, such as no loose covers, pillows, bumpers, duvets or toys. Bedding should be light, and if baby's sleeping bags are being used, these should be lightweight and well fitted. The room temperature should ideally be between 16 and 20 degrees. Hats are not to be worn by babies indoors. And your baby should sleep in the same room as you for the first 6 months. Smoking during pregnancy or after birth increases the risk of sudden infant death syndrome. If you or your partner smokes, we encourage you to try and quit. Ensuring that the places your baby spends time, such as the home and car, are smoke-free will also reduce the risk. If you or your partner smokes, you should not share the bed with your baby. Whether someone in the household smokes or not, we encourage you to access the Lullaby Trust's website. They have excellent advice and resources on safe sleeping for new parents. During the newborn check, the midwife will also inquire about your baby's nappies to see how effectively your baby is feeding and assess their general well-being. In the first 48 hours, your baby is likely to have only 2 or 3 wet nappies. Wet nappies should then start to become more frequent, with at least 6 every 24 hours from day 5 onwards. At the beginning, your baby will pass black poo, called meconium. By day 3, this should be changing to a lighter, loose, greenish poo. From day 4, and for the first 4 to 6 weeks, your baby should pass at least 2 poos a day. If your baby has not pooed in the last 24 to 48 hours, speak to your midwife or health visitor, as this may mean they aren't getting enough milk. The midwife will also check your baby for signs of infection. To reduce the risk of infection, we recommend good hand hygiene, such as washing your hands after nappy changes. Where possible, reduce contact with others who are unwell. While the cord is still attached, it should be placed outside the nappy and should be kept as dry as possible. It is generally recommended that the baby does not have a bath for the first 7 days. Lastly, the midwife will assess whether or not your baby has jaundice. Jaundice is a condition that causes yellowing of the skin and sometimes the gums and whites of the eyes. Yellowing of the skin can be more difficult to see in babies with darker skin tones. It might be easier to see yellowing of their gums, the whites of their eyes, and the skin on the palms of their hands or soles of their feet. Jaundice is common and usually harmless, However, it is important your baby is seen by a midwife to assess whether treatment is required. This is particularly important if your baby develops jaundice before 24 hours of age, is unusually sleepy or drowsy, is reluctant to feed, or has pale poo or dark urine. Your follow-up postnatal appointments will often be held in a clinic at the Children's Centre or community hub. As a minimum, you and your baby will also be seen on or around day 5 and day 10. If you need further support or advice outside these appointments, please contact your community midwife. Once the midwife is happy that you have recovered as expected, your baby has had the screening test they require, is registered and feeding well and gaining weight, the midwife will transfer your care to the GP and health visitors. This could be any time between day 10 and day 28. Health visitors are specialist nurses who work with families until the child is 5 years old. They support your transition to parenthood, offer feeding support, assess children's growth and development needs, support mental health and advise on minor illnesses and safety in the home. If you need advice or guidance on caring for your baby at home, please ensure you access NHS recommended sites or speak to a healthcare professional.